Welcome to COVID and Beyond, Aging and Disability Services for Diverse Communities, brought to you by members of the Older Adults Equity Collaborative. My name is Cheryl Wayland, and I'm the Director of Special Initiatives at SAGE, where I lead the National Resource Center on LGBTQ Aging, and I'm the host of today's live webinar. I'm also thrilled to be joined by co-facilitators and members of the Older Adults Equity Collaborative, Keisha Lewis and Shannon Patrick. Keisha and Shannon, would you like to introduce yourselves?
Yes, thank you, Cheryl. As Cheryl mentioned, my name is Keisha Lewis. I am a consultant with the National Caucus and Center on Black Aging, and I serve in the capacity helping out with the health and wellness program. So Shannon, I'll turn it over to you.
Thank you, Cheryl and Keisha. Hello, everyone. My name is Shannon Patrick. I'm a program director at MHP Salud. We're a national nonprofit organization that runs community health worker programs, and we've been serving the Hispanic community for 38 years. And we also have 25 years of experience offering training and technical assistance on the CHW profession. And I'm also overseeing our Strengthening Aging Services for Hispanic Older Adults program, which is our ACL-funded Technical Assistance Resource Center. So thank you for the opportunity to be here today, Cheryl.
Thank you so much, Shannon and Keisha, for joining us and being a part of this program. We also want to thank other members of the Older Adults Equity Collaborative, the National Indian Council on Aging, the National Asian Pacific Center on Aging, and the Older Adults Equity Collaborative Coordinating Center for their support in producing and hosting our webinar today. This webinar is also made possible with funding from the Administration on Community Living, U.S. Department on Health and Human Services. We welcome audience members to use the chat box throughout the webinar today to share questions, and we'll also have a live Q&A segment at the end of our panel discussion. The past 2 years have been unprecedented as our communities and world navigated and continue to navigate the COVID pandemic. For diverse aging and disability communities, the effects of a lifetime of increased health and economic disparities only exacerbated the impact of the pandemic on our communities. During this webinar, we want to reflect on what we have learned over the past 2 years and increase our understanding and knowledge of programs and services available to support diverse aging and disability communities across the country. I'm honored to introduce our panel today, who are here to share their expertise and knowledge as we look to the future. Our panelists include Deborah Stonewalls, Chief of Programs and Services with U.S. Aging. U.S. Aging supports the national network of area agencies on aging and advocates for Title VI Native American aging programs. U.S. Aging helps older adults and people with disabilities. Eden Ruiz Lopez, who is having some technical difficulties today with her video. We're excited to have her here. Eden serves as the Operations Director with the National Center on Elder Abuse, which serves as a national resource center dedicated to the prevention of elder mistreatment. Next, we have Erica Kelly, Chief Member and Advocacy Officer, Meals on Wheels of America, a national leadership organization supporting more than 5,000 community-based programs across the country, addressing senior isolation and hunger. We also have Jenny Polson, Center Director for the Senior Health Insurance Program National Technical Assistance Center, otherwise known as SHIP. SHIP provides training, technical assistance, and public promotion of the National SHIP program and 54 individual SHIP projects across the country. Joining us from the University of Maine Center on Aging is Leonard Kay, Director. The University Center on Aging promotes and facilitates activities on aging in areas of education, research, and evaluation, as well as community service to maximize the quality of life, older citizens, and their families. Next, we have Nicole Smith, Center Director, Senior Medicare Patrol Resource Center, or SMP. The center provides training, technical assistance, and national visibility to support the national SMP program and its 54 individual SMP projects. And last but not least is Richard Petty, Director, National Center for Aging and Disability at TIRR Memorial Hermann and the Independent Living Research Utilization Program. This National Center provides information, training, research, and technical assistance in independent living. I want to thank all of you for joining us today as our panelists. As you share about the programs, services, and opportunities within your networks to support the needs of older adults and people living with disabilities. I'll now turn the program over to Keisha and Shannon, who will facilitate a conversation with our panelists.
Thank you, Cheryl, and thank you to the panelists for joining us today for this conversation. As a result of the pandemic, could each of you share about the services you're finding most important for older adults and people with disabilities? I'll call on everyone, as we have a very large panel. I'll call on each one to offer some feedback on that question. So can we start with Deborah? And let me know if you need me to repeat the question. Deborah?
Thank you very much, and thanks for the opportunity to be here today. You know, up until August, I was actually the AAA director in Maui County, Hawaii. So when the pandemic hit, of course, we were right in the thick of it. And having now joined the staff of US Aging, I recognize that the AAA struggles they were nationwide, frankly. Every AAA experienced pretty much the same thing, the need to be extremely innovative, creative. Of course, food security was the first issue that we faced, and immediately AAAs and Title VI agencies across America came up with innovative ways. Staff jumped in to help in ways staff never had actually joined that mix quite, like, you know, they did it in a way they never had before. We started initiatives that not only supported our seniors, but that supported local businesses, food trucks. We were really concerned about economic security across the board. We also know that social isolation became a huge issue. It was already a concern for older adults and people with disabilities and their caregivers. We know that has been magnified as well. And many AAAs, Title VI's, many other community-based organizations initiated new virtual adaptations to programs. Again, just founded on an incredible amount of ingenuity and innovations. What we're seeing now is that some of our difficulties are enhanced because adult day services, I don't know if you guys are aware, but we've lost about 50% of adult day service providers across the country due to the pandemic. So now we're finding that reemergence is creating a new set of challenges. And I know that all of our networks together will find a way to again create innovative, ingenious solutions that will help folks remain healthy and safe. We know that housing is a major issue. Caregiver support, transportation, again, food security. We're right back full circle with the high cost that inflation is bringing. So I'll stop there because I know you guys also have other challenges your networks are facing.
Thank you, Deborah, for sharing. Next, I'm going to spotlight over to Jenny. Jenny, can you give us some input on your organization?
Sure. Well, my vantage point during the pandemic and at work is related to healthcare costs access and coverage, considering that the state health insurance assistance programs, or SHIPs, that I represent and serve provide insurance counseling for people with Medicare. We are hearing from many people who need help navigating Medicare, which has never been really easy and is especially challenging under a pandemic where illness, the need for social distancing, lack of access to technology, and closures are all possible challenges that people faced and some still face. So particularly, many Medicare eligible people have struggled with the initial Medicare enrollment, and it continues. We're hoping for some respite in the spring as reopening increases, but Social Security offices have been mostly closed to the public under the pandemic. And so the SHIPs have helped people needing to sign up for Medicare through Social Security, despite limited availability for appointments and the need for many people to use Social Security's online interface and the mail. So that has really been a barrier. Of course, if you don't enroll in Medicare under the right time frame, you can face lifetime enrollment penalties and pay more for your Medicare. So that's been an issue. One of the things that really emerged as a lesson learned and also reinforcement for helping professionals is we learned how important it is for people to be helped by someone who is kind, empathetic, and patient, especially under the pandemic where the many people that we serve have experienced profound loss. They've lost loved ones. You know, we've heard of SHIPs serving clients who lost their sons, daughters, caregivers who lost their mothers and fathers, you know, Medicare beneficiaries who lost their spouses, partners, and friends. So the SHIP counseling has been taking place in the climate of loss and grief at a very large scale. And I think we all realize how much harder it is to navigate, you know, legal and insurance issues, things that are highly technical, when you're overwhelmed by these stresses and this emotion. And so SHIPs make Medicare easier for people to understand. And when they are already suffering or overwhelmed, that automatically reduces their stress. Of course, as we all know, many people lost connection with their community. And so one anecdote that came in was there was a SHIP client whose only contact with the outside world was the person delivering her groceries. And the SHIP arranged for a COVID-safe in-person Medicare counseling session that she needed from a SHIP volunteer. And many of the people providing SHIP counseling are volunteers. Although during the pandemic, there were people who chose to stop volunteering. But in this situation, there was a SHIP volunteer who happened to live in the same senior housing facility. And so this not only met her Medicare and financial needs, it supported her emotional and social well-being. And, you know, I could say more, but I know that we have other questions coming. So I think at this point, I'll stop there and turn it over to the next person.
Thank you, Jenny. Next, we'll hear from Nicole.
Yeah, thanks, Keisha. And the purview really for the Senior Medicare Patrol, you know, is Medicare and specifically Medicare, but healthcare fraud, errors, and abuse. And so really what the pandemic has brought up, you know, in the fraud and abuse arena really is, you know, the COVID testing, vaccine, treatment schemes and there's different tactics that are used to fraudulently bill Medicare or just steal people's personal and medical identities. It really kind of evolves as the pandemic has evolved, and schemes really change a lot as, you know, vaccines were released, contact tracing, that really opened a window for a different way for people to scam, fraudulently bill for services or, you know, get people's personal medical identity just to sell it or use it or everything else that a scammer may or could do with that. I think that SMPs, the biggest thing is really staying on top of what's going on, those new trends that are coming up from the pandemic. I think, a lot of public emergencies, that fear of the pandemic, things like that, scammers really bank on that for our older adults and really anybody who's more vulnerable. And so, the other part of that, and Ginny kind of touched on it too, it's like the social isolation piece, when people are really disconnected from their communities, from their loved ones, everything, that makes people more susceptible at times for scams, to talk to people on the phone. They want to hear people, and that's who's calling, right? We hear people say all the time, their phone just rings off the hook, especially older adults. And I know that healthcare is one of those big things that they use to really get personal information or just scam older adults. So just to come back to, I think the biggest things are just for the senior Medicare patrols are really getting the new fraud schemes and trends out that are related to healthcare, to really get in front of it for older adults, just to make sure they're aware, of the red flags and what could come along with that, just so they can protect themselves. So I think the pandemic's really shown a lot of light on that. And also technology, the virtual pieces that have really come into play with security and just people going more virtual, that has created more of a window for scam artists as well, with spoofing and the internet. More individuals are using the internet to communicate and to get services and resources. And that's just a reality. So really educating people about internet safety, cyber safety has been a bit of a change, that really sped things up during the pandemic with fraud and abuse. So I think I'll stop there for now as well. So thanks, Keisha. Thanks,
All right. Thank you so much, Nicole. Next, I'm going to go on to Eden. Eden, could you please share with us?
Absolutely. Thank you, Keisha. Such great thoughts already shared for the panelists that had provided some insight related to this question. So I will for sure piggyback off of some of these ideas. So my perspective is really as an elder justice champion connected to the National Center on Elder Abuse. And for our very diverse communities across the country, people situated in both rural and urban settings should have equal access to resources. And honestly, there are so many that come to my mind. First and foremost, programs like being connected to adult protective services and long-term care ombudsman programs when the needs arise. So essential. And they're vital programs because ultimately they have the authority to investigate any allegations of elder maltreatment. First response services like law enforcement and paramedics are essential as well. And as some of the comments that were already made by actually all Deborah, Gina, and Nicole, and what they were alluding to, we aren't completely out of the woods yet with the pandemic, and we continue to see this threat of isolation. People have to be connected to, for instance, an emergency crisis counseling line. And I know that there are some wonderful options that are offered through agencies like the Substance Abuse and Mental Health Services Administration. I always think, with all of us, and especially with older people and people with disabilities, self-care is important too. We have to have connections to therapeutic and restorative services, telemedicine, counseling services. It's so important and vital to our well-being, no matter the age. Also, what comes to mind, just taking into consideration all of the resources that we connect people to throughout the country, legal assistance programs. I know some of us can imagine, or we can imagine, that someone may be facing a landlord-tenant issue or an eviction proceeding. So they should be connected to local services and programs that are capable of assisting them as well. Meals on Wheels programs. You know, we not only know that they provide vital nutrition, but their workers or volunteers are actually making those community-based deliveries. And for people within the elder justice realm, they could help in even detecting red flags of abuse, neglect, and exploitation. And then there's other things that come to mind, like if someone has limited financial resources, there's programs that they could be connected to, like the National Broadband Access Benefit, so that they could receive a federal subsidy to pay a portion of their rent. We need to be providing people with safe transportation to and from medical appointments and giving them safe access to public transit. Language interpretation also comes in mind. And then connecting back to one of the comments that I made earlier, I forgot to mention there are very promising models throughout the country. Like, for instance, in Los Angeles County, we have something called the Holistic Elder Abuse Response Team. And that's a partnership between a local community-based organization and the Long Beach Police Department. And they actually operate a periodic forum where victims of romance scams could actually go and talk with one another for support. So I could probably go on all day. Let me go ahead and pass it on to another presenter. Thank you.
Thank you so much, Eden. You kind of did a segue for me into Erica, who's speaking next for Meals on Wheels. So Erica, what can you add to this conversation?
Yeah, well, thank you. Thank you, Keisha and Shannon and Cheryl, and to the collaborative for the invitation. And of course, to all my peers and panelists, fellow panelists, doing all of this incredible work. Not to repeat, so I'll just do my best to add to what's already been said. I think one of the biggest points I want to underscore from the Meals on Wheels national perspective and in communities across the country is that millions of older adults really struggled with these issues of hunger and isolation before the coronavirus pandemic. And really the pandemic, it exacerbated these issues. And I think Cheryl, touched on that in her opening, and it really increased the need for services like Meals on Wheels. And so, looking back where we were, exactly two years ago, a little bit longer, is practically overnight, local community-based organizations, as Deb was talking about, had to adjust their entire models of delivering services. They stretched, they rose to the challenge, and they really responded in heroic ways and continue to do so. Very early on, food was determined as one of those most pressing needs of older adults, really due to social distancing, those challenges that occurred because of transportation access, concerns around infection, of course, with older adults being in high risk, at great risk of the coronavirus, and other kinds of limiting support for activities of daily living. So, I think food, of course, one statistic I wanted to share too is that the proportion of individuals aged 60 and older who sometimes or often didn't have enough to eat actually rose by 75% throughout the pandemic. So local organizations, I say Meals on Wheels, you're probably thinking about that meal that is delivered to the door. It's also about nutritious meals that are served in places like senior centers and community buildings, which had to, of course, shut down and in some cases have not yet reopened. So that was a full-scale conversion of congregate meals, individuals who are going there on a daily basis to access that meal for the day, and in some cases represents their one meal, a nutritious meal of the day. That had to shift overnight to a home delivered meal model, and grab and go types of innovations as well, or kind of take home meals, pick up meals. And so some of that is really going on still today. I also want to touch on the loneliness and social isolation, and that anxiety and depression rose dramatically throughout the pandemic. Again, a real challenge before, but it exacerbated. And over these last 2 years. And so 1 in 4 adults age 65 and older reported anxiety or depression during the pandemic. So just another issue that we're facing and is not going away for these communities that we're discussing. So and in all of our communities. And I think that's also an opportunity, because anyone you talk to has experienced what it means to be socially isolated. So there's greater awareness and attention there overall. And so just to kind of quickly summarize, what did we learn? Food delivery, of course, and making changes to some of our past models. So how do we continue access to things like grab and go or take home meals as another way to reach our older adult and population and individuals with disabilities? That was really successful, and we want to continue that. More ways of human connection and socialization services through virtual, as well as phone calls, other kinds of driveway conversations, just a whole host of services that help get that human connection, which improves overall health. And then also, I think we learned that there are other types of essential care needs or personal care products, household essentials that we were able to support older adults with as well. Things, like toilet paper, or when we can remember how hard that was to find early on, but it's also an existing need to support older adults. And then last, I just want to touch on what we learned from vaccination support. So rides to the doctor, rides to get vaccinations or making appointments, in-home vaccination programs. All of that was really essential too. And I think we'll need to continue going forward.
Thank you so much, Erica. Next, we'll hear from Leonard.
Thank you so much, Keisha, and I really appreciate having received the invitation to be here today. Let me attach a few numbers, a bit of data to all of the really critical points that have been raised. Let me begin by saying what others have alluded to, and that is older adults are facing dual public health emergencies. COVID over the last 2 years plus has devastated the older adult community. It has been 3/4 of the deaths recorded to COVID have occurred among individuals 65 years of age and over. That translates to 1 in every 100 older Americans. 1 in every 100 have perished because of the COVID pandemic. That compares to 1 in 1,400 individuals less than 65 years of age. Talk about a health disparity issue that has been driven home by the pandemic. That makes it loud and clear for us. But more generally, the pandemic has exacerbated existing health disparities, more precisely across various diverse groups. 1 in 1,300 white older adults have died during the pandemic, but that compares to 1 in 480 Black older adults and 1 in 240 Native Americans, and finally 1 in 390 Hispanic older adults. During this past 2 years, we've experienced what are estimated to be about 1 million excess deaths as a result of the pandemic. Here in Maine, where I'm residing, that translates into over 3,100 excess deaths due to the pandemic. And again, the vast majority older adults. The second public health emergency has been mentioned, and I'm really pleased to hear, several times already today, and that is the epidemic of social isolation and loneliness. This has never been more of an issue than it is today. As you heard, the feelings of isolation and loneliness have been increasing steadily over time. The pandemic caused massive increases in that experience. It's estimated now that some 3/4 of older adults are feeling isolated or lonely on any given day. You probably heard this, but people who are isolated are at greater risk of premature death because it's the equivalent of smoking 15 cigarettes a day. Who's at greatest risk? I think we all know it's diverse subgroups of older adults. It's those with physical and functional impairment, those who live alone, the LGBTQ plus community with weakened social networks and less regular visits to health professionals. It's the the 80 and 85 years and older population. It's those living on low income. And it's also those with minimal, what we call instrumental supports, access to transportation, to even a telephone or the internet. It's those living with poor mental health. It's those, and I'm going to emphasize this one because I think it may be overall the most significant factor. It's those with weakened or fragile social networks. And therein lies, I think, the charge ahead for providers, health and human service providers, and everyone else, including informal supports, family, friends, and neighbors who can come to the rescue, if you will, of older adults who are now disconnected from the hustle and bustle of daily life. It's finding ways in which to buttress social networks, because it's those social networks that can reconnect people, provide structure in their lives. Some reduce a sense of isolation, reduce loneliness, have a positive impact on stress and strain that has increased dramatically during this time. Unfortunately, as valuable as technology is, please know that it's not impacted positively in terms of reducing the sense of isolation and loneliness that older people feel. So it remains a supplement, but not a substitute for social supports. And I think as much as any charge that health and human service professionals have today, it is providing those services and supports that enable us to fix these broken connections that can help people thrive. I guess I'll stop there and contribute a bit later on, if I may.
Thank you, Leonard. That was great. Next, I'm going to move on to Richard.
And thank you very much. All of this great SAGE team, and it is great to be here today with you. And just to begin to cover some of the services that Centers for Independent Living are identifying in terms of needs for people with disabilities and older persons. And as I begin to cover those needs, I would like to tell you a little bit about Centers for Independent Living. ILRU, that's the organization that I am with, is an organization that supports over 400 centers for independent living around the nation. And centers are community-based nonprofit organizations that are run by people with disabilities. And people with disabilities are people who experience discrimination, and that's part of the vibe of the centers. And I think most of us would find a welcoming environment and a group of people willing to help with advocacy around a whole host of issues. But let's now move to the things that centers are identifying: a need for peer connections and peer support that can help fight isolation, that can also include people meeting to address the social drivers of health. It might be smoking cessation groups. It might be managing diabetes or a secondary disabling condition. As an example, pressure sores for people with spinal cord injuries. And centers, like many organizations, have pivoted to virtual communications, whether that's by telephone, webinar, or other ways, so that people don't always have to leave their homes at a time when there can be great danger in doing so, and the possibility of acquiring the COVID-19 virus. Access to vaccines is an important issue that centers are identifying, and it's certainly another need that centers are meeting quite well. They're helping people to have vaccines delivered. They're helping people to go to vaccine clinics to secure vaccines. They're working aggressively and actively with local health departments and other organizations and communities that can provide vaccines. Centers find that people need information and connection to other resources in the community. I've given you that example of vaccines. That's certainly one, but it might be resources for food to address food insufficiency, nutrition insufficiency. Many people with disabilities depended, and older persons too, of course, depended upon people to deliver food to their homes, and they depended on people to provide services directly to them in their homes. And with the pandemic, some had to turn down those services out of fear of acquiring the virus, and it placed them in very difficult circumstances. And centers have identified that as a need and have helped people find solutions to receive food and to receive community supports. And centers there, that brings us to another issue that centers have identified, and that's individual advocacy. Support for access to the community, support in receiving services, some of which we've already described. And sometimes it takes an advocate, another person with disabilities who figured it out for themselves very often and knows a lot of other people who are figuring it out and is helping a lot of people figure it out. And centers are ideal for not only knowing that those are issues, but helping to support people that way. Transition from institutions. Many people with disabilities were forced into institutions, and older persons too. Were forced into institutions that we all know are places that are very dangerous and where many people have caught the virus, and centers have been able to successfully help people leave institutions, move into the community, and find housing and other supports. Health literacy has been important. Knowing how to access health services, how to use Medicaid as a payer for services, or other funding streams, and to use all of that is certainly a great need, and centers have helped with it. So I'll conclude there for now and look forward to coming back later. Thank you.
Okay. Thank you all for sharing about these important services. I think we saw a lot of commonalities, and the conversation was great. And now I'm going to turn it over to Shannon, because I believe that Shannon also has a question for the panel. Shannon.
Thank you, Keisha. So to go on to our next question, we know that there are ongoing concerns around economic security within diverse communities. What services does your organization provide or recommend to people who may have difficulty accessing services such as transportation, nutrition services, health insurance or healthcare, and legal assistance, for instance? So I'll go ahead and call on you in reverse order. So why don't I go ahead and ask Richard?
Say again, please.
Sure, yes. We know that there are ongoing concerns around economic security with diverse communities. What services does your organization provide or recommend to people who may have difficulty accessing services such as transportation, nutrition services, health insurance or healthcare, and legal assistance, for example?
Okay, I'll proceed. And to help with this issue, centers have been very involved, advocating for access to programs of state and local government that can support people with disabilities and older persons, advocating for affordable, accessible housing, advocating for accessible public transit and paratransit systems, advocacy for equitable treatment in healthcare. And we know that sadly, in many hospitals, people with disabilities and older persons experienced great discrimination in receiving treatment during the pandemic. And centers have been at the forefront of ensuring that the ethics committees at hospitals are actively involved and keeping people from experiencing discrimination and being placed in very precarious circumstances and possibly dying because of a lack of care. Securing access to places of public accommodation, pet stores, places to secure food or any number of other places that the public goes to. And that's been especially important during the pandemic, and centers have seen that, and centers have helped a great deal with it. Thank you.
Thank you so much, Richard. So I will pass that question on to Leonard.
Thanks so much, Shannon. I have some simple messages to send in response to this question. Number one, all the services that Richard reviewed and the services that you're going to be hearing that can be offered by others, I think during the pandemic and as a result of the pandemic are services that will be especially needed by two particular subgroups of older adults, both of which are more likely to be confronted with health disparities. Those who live in rural communities and small towns all across America, and those who live in lower income inner cities. In both cases, older adults who reside there are most likely to be grappling with health disparities and need assistance. And I strongly encourage that we have our eyes wide open for the needs of those two groups of individuals. In providing services to them and to all other older adults, we need to remember that we need to remind ourselves that by far 80 to 90% of those individuals want to age in place. So the services that will be offered need to be the kinds of services that allow them to do that, if at all possible, that allow them to live safely with high quality of life in the settings that are familiar to them. Aging in place is not a fictitious concept. All of us want to reside in our own homes for as long as possible. So the programs that are going to be particularly crucial here are programs that keep them safe, keep them, make them food secure, enable them to reach their destinations, whether it be the supermarket, or the community center or visiting friends. We need to ensure that their mobility is maintained to the highest degree possible. The other services that are crucial, and they always are listed in the top 5 when surveys are performed of older adults, is information. Information provided around the kinds of services that you'll be hearing about today. You and I may know they exist on this panel, but too many older Americans don't. And we need, in particular, as a result of the pandemic and this sense of disconnection, we need to make special efforts to get the messages out that those services do exist. Less so in rural communities, perhaps, and in inner city communities, especially when they tend to be more centralized services that folks need to travel long distances to. But we need to go the extra mile to ensure that we get the word out in terms of what those services are and how folks can access them. And when doing that, please take full advantage of the informal support network. Again, families, friends, and neighbors who are the first line of defense for older adults. They don't turn to social workers or physicians first. They turn to their loved ones. And so frequently the pathway that we need to use to get the word out and help older adults get the help they need is via the informal support network.
Thank you so much, Leonard. I'm going to go ahead and pass it on to Erica.
Yeah, thank you. Some excellent points there from my colleagues here. I think I'm going to talk a little bit again about how Meals on Wheels really, things for you all to know, delivers so much more than just a meal. So it really is another access point to a lot of the things Leonard was just talking about. So it's that combination of nutrition plus social connection when the meal is delivered, safety, being alert and being able to detect if there may be a fall hazard or steps need to be repaired or the light bulbs are out. So there's a lot of work that takes place that volunteers are trained to be looking for, those eyes and ears in the home, as well as the connections to other services and supports and detection that Nicole was talking about related to elder abuse and exploitation. And they start to build that trust, with that staff person or volunteer that does deliver those meals. So an extension in many ways of family and caregivers, care provider support. So that's a takeaway that I hope folks will will remember. It is more than just a meal. And in terms of the offering of services and who's eligible, the primary piece of legislation that supports this nationwide network that is in nearly every community across the country is through the Older Americans Act. And we're actually celebrating the 50th anniversary of the nutrition program this month. So that's really exciting to be able to elevate and to help, as Leonard was talking about, to really raise awareness that these services do exist. But they're there for folks who are 60 years of age and older and are in greatest social and economic need. So individuals, and what does that mean? It's also individuals who have low income, are of racial or ethnic minority, live in rural communities, have limited English proficiency, or are put at risk of institutionalization and wanting to remain, living at home and aging in place. So I think, biggest constraint is around resources and making sure that we have enough capacity and funding to meet all of the needs in the community. But that is how they are targeted and to whom they are exist to support. So just a quick resource. I think I saw Deborah put in the chat some great resources, and I know she'll talk about it. Another one, if you have loved ones or neighbors or family members who are looking for these types of services, on our website as well, mealsonwheelsamerica.org/findmeals is a great tool to help you get connected with local organizations. And I know there are others out there too. So I'll pause there and go to Shannon.
Thank you, Erica. And if anyone has resources and is not a panelist that they'd like to share, you can go ahead and add those to the chat as we're speaking. I'm going to go ahead and open it up to Eden to answer that question.
Thank you very much, Shannon. So at the National Center on Elder Abuse, a large part of what we do is connect people to local resources. And our center, I think out of all the resources and information and services that we provide, this information and referrals component to members of the public is essential. We also provide technical assistance to professionals as well. But in relation to identifying resources, we can help, for instance, people acquire information about where to report concerns related to elder abuse, neglect, and exploitation. We could make referrals to the Alzheimer's Association if, let's say, a caregiver needs some sort of counseling or support, or they need to be connected to respite-related services. You know, in terms of my response related to legal referrals, we can't necessarily refer people over to a specific attorney, but we can refer people if they have questions related to powers of attorney or a guardianship proceeding to a local legal aid office. Of course, we always send people over to the elder care locator and connect people with local area agencies on aging if they're looking to identify, for instance, low-cost clinical care, or they're looking for an inclusive and welcoming community center, just a whole range of sort of information and referral services that we provide. Also at our resource center, we can point people in the direction of current research trends related to abuse of older people and people with disabilities. We have a range of different publications. I'll be sure to share a copy of a link in here. And we have recently gone through revisions on 2 popular research briefs that we do have available for print that focus on research findings of people with disabilities and people that identify as LGBTQ+. So not only that, we have a number of resources that are available in as many as 12 languages like Spanish, Chinese, Korean, Farsi, and we really try and assemble information and hit on current trends that address many issues spanning from financial abuse, substance abuse, a number of different topics. So that's it for me. I'll pass it on to the next panelist. Thank you.
Were you able to hear me? I think I unmuted myself. Okay, Nicole, it'll be up to you.
Thank you. Sorry, I had to find my mute button, Shannon. I think one of the big things that senior Medicare patrols really, have to offer again, to serve, caregivers, beneficiaries, and really protecting people and providing more of that one-on-one assistance, in local communities to be able to provide education, resources. Again, just to reiterate, preventing types of fraud schemes, any type of fraud or abuse is really the best way, to education is the best way to combat that, right? To prevent it from happening in the first place. So I just want to reiterate that again, that's one really big thing that senior Medicare patrols do in their local communities, really that one-on-one assistance. And again, it's very many, it's different ways. And I know there's been some education resources with expanding virtual capacity in different ways within the SMPs, because of the pandemic, of course, and just being able to educate and reach people in different ways and more diverse ways, really to just be able to get that message out. along with, being able to use mail, over the phone, even if it's counseling, using different and diverse ways to be able to meet people really where they're at with what they have, really what they're comfortable with, to either, educate them, or something else that the Senior Medicare Patrols also do is they do take complaints when people are victims of potential fraud as well, with healthcare. So being able to have those counseling sessions as well in a safe and place that they feel comfortable with, really talking to the person, the SMP, about those situations, or it could be an error as well with Medicare, and those are important to have corrected as well. One of the big, reasons and services for all of that is the security piece of it. Is if somebody is a victim of medical or personal identity theft, or their Medicare was billed fraudulently, they could be billed for services that they either didn't receive, and that's a financial issue for a lot of older adults. Or they may not be able to have access to care that they need. If something's been billed fraudulently, they may not be able to get that service again until the next year. And so that creates issues with their healthcare, and could be quality of life at that point. So I think that's the biggest thing that Senior Medicare Patrols really can provide, in the community nationwide for individuals. And I'm going to go back just to the preventing piece as well, because I did put this in the chat, but we have a very unique tool that's really beneficial for consumers, beneficiaries to use, called My Healthcare Tracker. And it really is so people can be stewards of their own healthcare and manage that and track what services they're getting. And then they can look at their Medicare statements and compare those, and that can flag fraud for people, and, really get ahead of it before something might happen, so they can get it corrected. So yeah, I think that's the big takeaways for SMP of what, can provide and really meet people where they're at, to resolve concerns like that. So yeah. Thank you, Shannon.
Nicole. Thank you so much. And I'll pass it on to, last but not least, Deborah.
Thank you. I did go ahead. I hit that button a little too soon, the enter button, but I figured we'd be running kind of short on time at the end here. So I wanted to get the resources out there. I will, Erica mentioned the Older Americans Act, and that does serve as the, I guess, basis on which, the federal platform on which area agencies on aging, ADRCs, function across America. And they serve as a hub for many services and supports that are available in local communities. So if people are not certain where their area agency on aging or Title VI agency is, they can go to the Elder Care Locator. That's our national, you can go online, put in a zip code, or call. I think they even have chat available. And many of our partners are actually on the call as panelists for Elder Care Locator. We also have a national call center that is the Disability Information and Assistance Line dial. That was created to specifically assist individuals with disabilities have access to vaccinations, to transportation, and to many other services that they need. We also, again, have our partners for dial on the call, Richard being one of our most outspoken and eloquent partners, right, Richard? So we really rely on our partners to help us get things right in these regards. US Aging is also, as is Meals on Wheels America. Shannon, I believe, that MP Salud, I hope I got that right, is also a partner, MHP, sorry, in Communities Rise Together. And that effort is working to ensure that communities of color, diverse individuals have access to vaccinations, to boosters, to transportation if they need it. Many of our partners are combining some of that. If an individual gets a vaccination, there's an incentive through a food card. So we're meeting two needs at once with that, health and safety around COVID, as well as food insecurity. Jenny and the SHIP has also been really an integral partner in getting the word out for how to talk to individuals who may be vaccine hesitant or vaccine resistant from a variety of diverse groups. So I would recommend that you go to the SHIP website. They've got a really cool guide that they put together for talking with someone if they're vaccine hesitant or resistant. So I just want to thank all the folks. I mean, I think we work together in so many different ways, and it really does take our collective efforts to reach out and connect. Chromatic Black, Migrant Clinicians Network. There's so many incredible organizations that are really locking hands, locking elbows, jumping in full force to work together to help people get service needs met. So I'm going to hit enter one more time. It's a little bit more organized this time with some other US Aging programs. But thank you so much.
Yeah, thank you, Deborah, for that. Just wanted to loop back around to some opportunities for live Q&A. So if any of the audience members have any questions for our panelists right now, we'd be happy to hear from you. So feel free to put those in the chat, and we'll be sure to see what our panelists have to say.
Thank you, Cheryl, for the reminder. And then I just wanted to pass it to Jenny. I apologize, Jenny. I want to make sure you get a moment to share your insight as well. So go ahead.
All right. Thank you, Shannon. The word partnerships has come up, and I want to say that I believe the SHIP network that I'm representing today really leaned into their partnerships to quickly respond to the pandemic. The SMPs, ADRCs, AAAs, everybody really banded together to help each other figure out the technology solutions, or at the local level, reach isolated people who might be connected with Meals on Wheels or home delivered meals, but not, their SHIP counselors. And so that was essential. I have a little case study when you, speaking of access, that I wanted to share, because I know, how important it is to reach diverse communities who might be isolated because of language. And with the SHIP role, it's important to have somebody to help you with your Medicare problems and to try to backtrack and fix them. And so this is a story that came in from a SHIP. They were working with a non-English speaking beneficiary who had both Medicare and Medicaid, and their Medicare was a private Medicare plan and it wasn't working for him. His in-home services had been terminated because the agency that he was working with was not in the network of this plan that he had enrolled in. And the SHIP counselor, who spoke his native language, was able to work with him and figure out what happened. And at the root of it, it kind of ties into what Nicole was talking about in the roles of the SMPs. This non-English speaking beneficiary had received a misleading notice. It appeared to be an official Medicare notice. I don't know, who this beneficiary had read it to him, since English was not his first language. But in the tiny print at the bottom, the bilingual counselor was able to notice then it said that it was from an insurance agent. And so the beneficiary did not realize that when he responded, he'd been enrolled in a different plan, and it was a plan that did not meet his needs. So this is an issue both the SHIPs and the SMPs help people with. And they were able to get it fixed, working with the Centers for Medicare and Medicaid Services. And then he was able to resume getting in-home services. So just quickly, a few other examples of Medicare problems that were exacerbated by the pandemic that SHIPs help with. We're hearing about people who stayed on Medicaid expansion because it was, made more available as part of a national pandemic response. They stayed on it despite becoming eligible for Medicare. And in those situations, people could face lifelong late enrollment penalties for their Medicare. And so sorting through that issue, especially when the public health emergency expires, sorting through that issue is going to be a big area of work for the SHIP. So if you know somebody with that problem, if you have clients, friends, family with that problem, really contact the SHIP for advice and help navigating, what the solution might be. Like the story I told, there were people who neglected to review their coverage. And during that time when they're able to make changes, the Medicare follow-up and enrollment period, there could have been lots of reasons. They could have been ill, they could have been grieving, they could have not been able to get help, not use technology, lots of barriers. But not reviewing existing coverage and then comparing it to other plans during the follow-up and enrollment period can really impact people's health access and their finances. So again, getting help from their SHIP is crucial. So, and as Deb alluded, we provided the SHIP network and the public with COVID-19 materials in multiple languages. And new today, we have audio, for people who need to hear it, not read it, on COVID-19 vaccines, tests, and Medicare coverage of treatment. And I know we're low on time, so I'm going to stop there.
Thank you so much, Ginny. And with that said, I'll pass it on to Cheryl to read some of the questions from our Q&A.
Thank you, Shannon, so much. And thank you, everybody, for sharing so much information. Each one of you could have done an hour-long presentation just on your organization, but really glad to have you all here today. We have a great question that just came in, and I think it's one that we probably are all thinking about, but would love to hear from the panel. And if people in the audience have suggestions, feel free to put those in the chat as well. Do any of you have tips on innovative ways to combat COVID exhaustion? People are tired of hearing about COVID and ready to move on. And I see Deb raising her hand. So Deb.
And it's my actual hand, not my virtual hand. As I saw your question, Kay, I just thought one of the things we could do is, we have implemented and done some really creative programs, and we're continuing to innovate. And I think the more that we just present programs in an innovative manner, giving people a choice of how they engage, it's still providing safety around COVID, but we're not specifically saying we have to do this because of COVID. I think if we just keep moving forward with these innovations and we leave the reason off the table, here's a new program, let's try it, it's great. That might be one we could do it. Just move forward with those innovations.
This is Richard Petty, and I'd like to add just a thought. Those are excellent points. We're all tired of the pandemic. We wish it were over, and things are better, but we don't have any guarantees that it is over at this point. So as much as we are tired of isolating and tired of wearing masks and anxious about going places, and yet some of that still may be called for. However, as organizations, we can do our best to connect people with one another, whether in person, possibly in outdoor settings, or possibly in indoor settings while masked, or virtually through Zoom or telephone. Keep people connected with one another, and have opportunities to address other issues when they are together and not just talk about the pandemic again. And also to make sure that we have ways of suggesting that people develop regular schedules and support them and encourage them to be on regular schedules, and where possible to get some exercise and to be outside wherever possible, and sometimes that is possible now. So some of those things do seem to be very helpful for people as we are. Here we are in the third year of the pandemic, and gracious, it's not fun. It's difficult, but there are things that can be done.
So let me just add to the list that Richard offered and suggest people get a good night's sleep, suggest that people try relaxation techniques of all shapes, sizes, and varieties, whatever is to your liking, mindfulness meditation, aromatherapy, yoga, tai chi, whatever works for you. Home gardening may work for you. Getting a pet and walking that pet around the neighborhood.
Yeah.
This is not rocket science. These are simple, straightforward solutions that allow people to let their hair down and recover after 2 years of challenge.
Great ideas.
Thank you so much for that question, or for the answers to that first question. We have another one that I think Erica might have some thoughts on, and it's around volunteerism and what are organizations doing right now to kind of re-engage with volunteers as we continue in the pandemic, and what does that look like?
That's an excellent question, and I think I touched on it a little bit in kind of that first question. Right when the 2+ years ago, when the pandemic hit, many of the Meals on Wheels programs and the services that we're talking about operate with volunteers. That's a huge part of how the meals get out the door, how they get prepared, how they get packaged, and saw a tremendous drop. Many of the volunteers are older adults themselves and were concerned, or they kept on delivering, and then local programs got phone calls from caregivers or family members saying, Mom, Dad, Grandma shouldn't deliver anymore as a result too. So we have not yet seen the level of volunteers rebound since before the pandemic. And I think I saw another question in here about what pivots are permanent. And I think that this is one of them, that volunteers are always going to be needed, but perhaps it's not in the same level that we were before. Having an organization that is your delivery model is based solely on volunteers may not be sustainable. I think in what we're doing at the national level, this has also been, let me back up a little bit, has also been exacerbated by gas prices and many volunteers, high gas prices, and volunteers living on a fixed income or, just struggling with inflation and costs increasing overall, have to cut back on their delivery days too. So I realize I'm talking about a lot of problems versus solutions, What we're doing at the national level is, again, continuing to raise awareness about the need for volunteers, the impact that that has on health. And, you know, we hear so many volunteer stories. Leonard was talking about telling the story and talking about it. Volunteers get more out. They say they get more out of it than those that the relationships that they're building and the individuals that they're helping to support. So there's a great story to be told there. We're also partnering with other corporations to help with gas cards, or how can we retain volunteers and to help support them. We have a volunteer summit that is actually coming, or symposium that's coming up during National Volunteer Awareness Week. The actual date is April 21st. So that's, we're gonna have a day-long event that is actually talking about this very issue. So feel free to reach out to me directly, and I can put my email address in the chat should you have other questions.
Thank you very much, Erica. And we have folks asking if the video and resources will be available. And yes, they will. There will be an email going out, I believe tomorrow, to all the attendees that will have a link where you can see the resource guide. We're also going to have another web page available, linking to many of these resources that our panelists have shared today. So we'll be getting all that information back out to folks. Are there any other remaining questions for us as we come into our last 11 minutes of our time together? Deb, yes.
Cheryl, I saw a question about what can we never go back to, right? And I think one thing that this administration anyway may have learned is, or we learned from, I don't remember which administration it was, but the whole thing of making seniors and people in rural areas sign up for COVID vaccinations only online. I hope we've learned that we can never go back to one way of getting health and safety out to people in the community. And I know that you know, one reason the dial line was formed was because of the reality that some people with disabilities cannot access the internet in such a way as to get that type of help they need. So I hope we never go back to only one way of people getting help that is virtually based. We know that broadband is not at this point equally accessible. It's not even addable to some HUD sites because it wasn't in the original HUD agreement. So we are trying to work at the national level to number one, increase that broadband access, but number two, be sure that we have plans in place that make getting the help people need in the way they need to access that help available to them. So, wasn't very eloquent, but.
Thank you so much, Deb. I really appreciate that. And I know I'd like to leave time for Shannon and Keisha. If you have any closing remarks that you would like to share, you know, with our audience today or the panelists.
Cheryl, I just wanted to say again, thank you all for being here. I think this was a much needed conversation and I learned a lot. And so I hope that those on the call learned a lot from you all too. So much appreciated.
Thank you, Keisha.
Yes, and I'd just like to say thank you on behalf of MHP Salud and our Technical Assistance Resource Center. It's been great to be here and help facilitate the conversation. I really appreciate learning from all of you. And I hope that our attendees also learned something new today as well. I know Cheryl mentioned this in the chat, but I just wanted to say we will be sharing a lot of the chat conversation follow up, just because I did see a few people asking that question. Thank you so much to all the panelists for being here today.
Thank you, Shannon. Thank you, Keisha. Really been incredible partners in this work, so I appreciate that. I also want to share one of the reasons why I felt like this was such an important topic for us to take time to really think about is because I had many older adults within the LGBTQ plus community asking, do I qualify for these services? How do I know if I qualify? And I knew the answer, but they didn't. So how do we make sure that all LGBTQ older adults, all diverse communities know that these programs are available for them? And so that's why this topic was so important for me, to really bring to light, and that we're all making an effort to reach out to the diverse communities across the country who really need the services and supports that you all talked about today. With that, I just want to share that, on behalf of SAGE's National Resource Center and the Older Adults Equity Collaborative, I want to close by again thanking our esteemed panelists, as well as my co-facilitators for the lively conversation and your commitment to serving diverse aging and disability communities across the country. There will be a survey provided at the end of the webinar today, as well as in the link that you'll be receiving later on. And again, that will have information on the resources that are available. If there was a question that you did not get answered today, please feel free to reach out and we will make sure that we find an answer for you from one of the panelists that are here with us today. So again, just want to thank everybody for being a part of this program. And we will go ahead and sign off for today, but we won't be strangers because we'll all be around. So thank you all so much.